I'm Dr. Mitchell Mandel, board certified dermatologist, and I'm going to talk to you today about adding Diolaze hair removal to my practice. I'm a board certified dermatologist. I've been in practice over 20 years, and my practice offers medical dermatology as well as laser, surgical, and cosmetic dermatology. I practice in two offices where I split my time 50-50. I have one office in Manhattan and another office in Jericho, Long Island, about 25 miles outside of Manhattan. Both offices we practice both general dermatology and cosmetic laser dermatology. Between the two offices I have 15 machines with 32 different handpieces, ranging from the Altis Cool Glide, a Medlight C3, every Fraxel, the Repair, Clear and Brilliant, Fraxel Restore, which is the Fraxel 1550 and Fraxel 1927. I have two Cytons, a Thermage, two Isolazes, and eSeminar, various other lasers which I can't even remember. Why did I need a Diolaze? Well, in my practice, speed, patient comfort, and efficacy are the three factors that really matter the most to me. And while I have various other modalities for hair removal, the Diolaze offered increased safety, increased patient comfort at a speed that I was not able to approach with any of my other devices in the past. Hair removal is still the most popular aesthetic procedure performed. It's the third most asked for non-surgical procedure behind Botox and hyaluronic acid fillers. 1 million women spend over $1 billion per year on electrolysis and lasers, and 80 million women spend $500 million on shaving, waxing, and other hair removal accessories. 25% of laser hair removal clients are male. However, in my practice, the trend is increasing in the male usage. Probably about a third of my patients now are male, and it's probably higher than that, getting closer to 40%. There are many new trends in hair removal. Online, Groupon, and other specials, spas are increasing the use of laser hair removal and the increase in male patients. Many considerations are taken into account when choosing what laser to use and what modality to use for hair removal. Patient skin tone, hair color, various different parameters with laser fluence, pulse duration, spot size. The most important in my practice is the speed at which I can give a treatment and patient comfort. And that's where the cooling of the handpiece comes in, and of course the efficacy. And there we're talking about what wavelength to use. The Diolaze is a diode laser, 810 nanometers, and you can see from this chart we're still getting a very high absorption in the melanin spectrum, zero in water basically, and the blood is lower down on the absorption spectrum using an 810 nanometer diode laser. The other lasers that have been used in the past and still used for laser hair removal, the ND-YAG, which is 1064, is the best laser for type 5 and 6 skins as far as safety. The efficacy is nowhere near what we see with a diode laser or an alexandrite or a ruby, but in dark skin that's the only option affordable to us. For type 4, 3, 2, and 1 skin, the diode is really the gold standard and the most efficacious in laser hair removal. When I talk about speed of hair removal, 20 years ago, the original lasers were very, very slow, big, bulky boxes, and took very long to treat whatever problem we were treating. Here we're taking a look at different lasers. We see that the Diolaze has a 400 millimeter spot size. And at that spot size, you can get fluences up to 60 joules per centimeter squared. When we look at any of the other lasers, whether it's the Lightshear, the Vectis, Gentle YAG, and Apogee, we're looking at spot sizes as small as 27 millimeters, as large as 870 millimeters. The problem is with these larger spot sizes, the peak energy is a third to a quarter of what we see with the Diolaze. The Diolaze gives us both high power, high spot size, and where we can see 30 joules per centimeter squared in 30 milliseconds pulse width, we can go up to 40 joules and up to 60 joules with an 80 millisecond long pulse width. All the other fast diode lasers compromise either the power or the pulsing, where with Vectis we can get a 300 millisecond spot size for darker skin types. We can only go up to 20 joules. Lightshear Duet, which uses a similar wavelength to the Diolaze, only goes up to 12 joules per centimeter squared, almost less than 20% of the peak power of the Diolaze. The speed of the Diolaze is amazing. The picture you see is the first hair removal laser I had, the Altus Cool Glide, which I purchased 16 years ago. I still use it for one reason. The head gives me an 8mm pulse, and in tight areas around the bikini line or in skin folds, we'll still use this laser. It's very effective. But as you can see on the top, the gold tip gives us a pre-cooling only. There's no active cooling when we're firing the laser, and there's no post-cooling unless you actually drag the tip back over the area just treated, effectively doubling or more your treatment times. With an 8mm pulse, with this laser, which we've treated a male back, it can take 3 hours or more, and it's pretty uncomfortable to the patient. One of the unique features of the Diolaze, which is one of the reasons why I purchased the machine, is the cooling effect that we get. Diolaze has a 3-piece cooling for ultimate patient comfort and ultimate patient safety. We pre-cool the skin, parallel cool, and post-cool, meaning as we are dragging the laser across the skin and treating, each area gets treatment from the pre-cooling part of the head. As we're treating through the sapphire glass of the laser, the sapphire is getting cooled, and there's a post-cooling below the sapphire. So you're really cooling before, cooling during, cooling after you're treating the patient. Most of the other lasers either have secondary cooling with air cooling, or they have a pre-cooling tip on many lasers, but no active treatment and no pulse, and no post-cooling. Some of them have parallel cooling as well, but then they don't have pre and post-cooling. Here we're getting all three, and the comfort to the patient is evident, but the safety to the epidermis is probably more important than the patient comfort. So here we're going to see two videos, one with the Diolaze and one with my next fastest hair removal device, which is my Cyton BBL, which is not laser, but uses intense pulse light. The Diolaze still is faster than the BBL, while giving us the advantage of the 810 nanometer laser wavelength and the pre-parallel and post-cooling for patient comfort and patient safety. With my Cyton, I can treat a male back in about 45 minutes to an hour, whereas with the Diolaze, the male back is going to be treated in 20 minutes or less. Here we're showing two videos, one treating the leg at the so-called beginner speed or normal speed, which is still faster than any laser I've ever used for hair removal. And pretty quickly the operator gets used to the speed of the laser, and at full speed the treatment times are as fast as you're going to want to treat somebody. With the Diolaze, what we have is a scanning device which takes our diode laser, and you'll see the blue light on the top of the handpiece as the laser scans back and forth over the skin. This enables us to really treat large parts of the body very effectively and very quickly, while still keeping the patients very comfortable. The Diolaze handpiece, which you see here, it really is the most efficient hair removal device on the market today. I have 3 other hair removal lasers in my office, and really there was no reason to get another one unless there was an improvement in technology. Here we're using the 810 nanometer wavelength, which is the gold standard. It gives us the highest peak power, similar to a light shear, while enabling us to still treat at high speeds. The largest spot size with the scanning technology, high pulse repetition rate, and the 3PC cooling, the strongest cooling, gives us the highest degree of patient comfort and the highest degree of safety to the epidermis while we're treating patients. The InMode platform in addition to the Diolaze handpiece, has various other handpieces that enable the clinic with one device to treat all aspects of the patient's skin. The Fractura or fractional RF skin treatment enables you to get skin tightening, scar revision, as well as treating pigmented lesions. The Forma or skin body remodeling tips enable you to non-invasively treat patients for skin tightening. The IPL handpiece gives you the highest peak power in an IPL handpiece, which enables you to treat all the aspects of skin that you would treat with an IPL device with fewer treatments. The laser hair removal, the Diolaze we've talked about, and the non-invasive body contouring and cellulite treatment, Body FX, enables you to use radio frequency to treat unwanted fat, skin laxity on most parts of the patient's body. So in my clinic, in most clinics, up to now, they've had various different devices to treat all these different problems. You can have a fractional laser, you can have a non-invasive radio frequency device, an IPL device, various different hair removal lasers, many different non-invasive body contouring and cellulite treatment devices out there, many of which are not effective up until the last 2 or 3 years. Here you can have in one platform basically a plug-and-play device where you can, with one device, treat the entire patient. You don't have to have 3, 4, 5 different machines anymore. One machine will enable you to treat all aspects of a patient's skin that they want improvement on. Thank you very much. You see the web address for InMode below, and direct any other questions you have directly to them.